there's a requirement in terms of doing the right thing for the patients to start with, but secondly around managing increasing demand. That patients are known to call 999 predominantly because they don't know what else to do. They recognise that they need something. They recognise it probably isn't actually an emergency in its truest sense, but they need something pretty quickly. The difficulty once you've got into that cycle really, or onto the conveyor belt of care, is that to be able to make good quality clinical decisions around what that patient needs and how they can access that care is sometimes difficult, because they may have quite complex previous medical histories, which are difficult to unpick if your only source of information is the patient themselves. They won't necessarily have a detailed understanding of what's wrong with them. Within that scenario then, the default is to refer to another agency with a limited clinical picture, or to take the patient to ED, because in all cases it's doing the safest thing for the patient. To help them along the way with that, understanding a little bit more detail about the patient's pre-existing medical condition would be very beneficial. I think it would help to provide reassurance around the safety of a referral to another agency, provide maybe some additional support in that decision-making process. I think, as we said before, that it would be important for the paramedic in the pre-hospital field to make decisions around the next steps for that patient. And similarly, even if the patient did need to be conveyed to an emergency department, it would equally help the emergency department clinician to make decisions around safe discharge. So the ability to understand more about that patient at the time is really important. Accessing information it's almost a double-edged sword, so it can be too much or too little. I think the risk currently is that there's too little, but there can also be a similar risk of there being presented with too much information, or that the information is presented in a format which is hard to read or hard to kind of get to the real kind of important parts of. So I think the summary presentation needs to be configurable. I think it needs to demonstrate in a kind of a first page of current medications, known allergies, current diagnosis or multiple diagnosis, whether a care plan exists, whether there have been recent contacts with other healthcare professionals. If the care plan exists, then who holds it, where is it, and who are those carers? I think you should then be able to click through into other pages that sit behind that. So you have a summary page almost, and then layers that sit behind that which provide detail. There have been, and I think they're probably getting fewer, but there have been cases where do not resuscitate orders have been in place for patients, but they've not been made available or made known to the responding paramedic crew, or they've been in a format that the crews have not recognised, or they're out of date because they've not been updated more recently. And I think with all those things, it starts to introduce doubt into the process, which is, in that scenario, what the patient doesn't need, it needs to be very clear. So I think if there's clarity around reporting and clarity around real availability of up-to-date information, then that would be incredibly valuable both for the patient and of course the patient's carers, because it's incredibly stressful for everybody there in the scenario where the patient is either apparently dead or in a near-death situation, for the NHS to arrive on scene and to look like they don't really know what to do next because the information's not there for them to support that process.